I will now ask Hattie to call the roll.
Oops, you're muted, Hattie.
Yeah.
Oh, no.
My phone was ringing. I forgot. Okay. Terry Ann Jones.
Here.
KJ Starr.
Hello.
Mary Pike.
Here.
Johanna Berry. Johanna.
I haven't seen her yet.
Okay. Kozar Mohammed. Kozar, you out there? Paul Pentel.
Here.
And Anna Arkin, you said she wasn't going to be here tonight, right? Laura Rangard.
Laura could not attend either. Laura
Sorry.
could not attend, yeah.
I wasn't listening very well, was I? Jerome Evans.
I'm here.
Kathy Tuzinski.
Here.
Britt Pope. Britt, are you there? Wanda Felder. Wanda. Angela Watts.
Here.
Craig Hedberg.
Here.
Yolanda Adams-Lee. Yolanda. Aaron Hurley.
Here.
We have 9 people attending tonight, and you have a quorum.
Okay, excellent. I also know that we have a lot of guests here tonight. I'm wondering if I shall name them, or should we just let that go? And if they want to, the speakers at least can introduce themselves.
Yeah, what I told them at the beginning as we were waiting for members to join is that the members would do introductions of themselves, and then right before their presentation, we could have them introduce themselves.
Oh, okay. So should we go through now and introduce ourselves? Is that what you're suggesting?
We could do that now. We could do it after some of the committee business was done, whenever it feels right. Yeah.
Okay. Let's go ahead and do that, to do the committee business. Okay, so we can now proceed to the approval of our agenda for today's meeting and the minutes from last month's meeting. As before, we're going to fold the approval of the agenda and the minutes into the same motion so we can do the roll call just once. When you're ready, would someone like to make a motion to
I have a motion.
Agenda and the meeting minutes from October?
Kathy, I have a motion that we swap 6 and 7 on the agenda. I'd like to talk about the lead presentation before Gretchen gives her update, so we can also talk about how we move those recommendations forward.
Okay.
So then I will also move that we adopt the agenda and the minutes, but the agenda as amended.
Okay. Do we, protocol here, do we have a second?
I second Angela Watts.
Okay, all in favor, say aye, and I guess we would do a roll call.
Yeah, we don't have to say aye, all in favor, but we can do a roll call.
Okay.
Okay, ready? Terry Ann Jones.
Yep. Yes. Approve.
KJ Starr.
Aye.
Was that a yes? I'm sorry, KJ.
Oh, that was an aye. Sorry.
Okay.
It's loud out here. Louder
Mary
in my
Pike.
house, believe me.
Yes.
Mary Pike.
Yes. Aye.
Johanna, have you joined us yet?
I'm here.
Oh, good. Did you hear to approve the minutes and the agenda? That's what we're
Yep, I
voting
heard
on
the
now.
second. Yep, aye.
Kozar. Paul Pentel.
Aye.
Jerome Evans.
Aye.
Kathy.
Aye.
Britt, have you joined us yet? No, Britt. How about Wanda? Angela Watts.
Aye.
Craig Hedberg.
Aye.
Yolanda, are you out there yet? No. Karen?
Aye.
Okay, it's been moved and approved.
Okay, excellent. Well, I think at this point we can go through and do some introductions. And I'm going to suggest that, unless if anybody else has a better suggestion for this, I was thinking I can start, I will call on somebody else who I know is a member. They give their intro, then they call on somebody they know is a member, and we just do it in that fashion. So got a thumbs up from Margaret, so we'll start there. I'm going to keep it short. My name is Kathy Tazinski, and I am a resident for Ward 13. Aaron.
Aaron Hurley. I'm an at-large member. I live in Ward 7.
Okay, Aaron, do you want to
And
call?
I will call on Angela.
Hi, Angela Watts, and I represent Hennepin County.
Okay, Angela, you want to call on someone?
Jerome.
I am Jerome Evans. I represent Ward 12. And I am going to call on Britt.
Hi, I'm Britt Culp, she, her, hers for pronouns, and I am the mayor's appointee. Who else is here? Sorry I'm late, by the way.
No
Yeah, no
worries.
worries. Britt, you want to call on someone else? We're doing members to begin with.
Huh?
We're doing members to begin with.
Okay. I don't even know who's gone yet.
Oh, yes. So I will just suggest KJ Star.
Okay, I will call on KJ.
Hello. KJ Star, I'm the rep from Ward 2. I think that's all I need to say. I'll call on Johanna.
Hi, I'm Johanna. This is my very last day of my 6th year.
I know, I can't believe it, right?
Represented Ward 5 for a long time. So yeah, outgoing 5th Ward. And I will call on Ollie because I haven't met Ollie.
Okay. Is Ollie, I think, is a guest. So have we, I don't know if we've gone, no, we haven't gone through what I'll do the next one, unless if you want to name a name.
I'm having a rough time on top of my head. Andrew. Andrew's sitting there. Hi, Andrew.
Andrew's also a guest.
Oh, well, that would be why then.
You're getting a little, you know what? Let's just do it that way. That works totally fine. Andrew, if you want to go next.
Hello, everyone. My name is Andrew Savitz. I'm a new resident of Ward 1 and happy to be here as a guest.
Excellent.
And I'll just add in that Andrew and Christopher, who is also online, are PHAC applicants. So they are interested in the member at large position and were interested in attending a meeting so that they could see what the PHAC is all about.
Excellent.
So thanks for coming, both Andrew and Christopher.
There we go. There's your intro, Christopher. Okay, let's get back to the members here. We've got Mary Pike.
Hi, I'm Mary Pike. I live in Ward 3, which is Steve Fletcher's ward. And a fun fact, Mayor Fry lives across the alley from me.
Wow. That's pretty
Did not know that.
So let's turn it over to Terry Ann.
Hi, I'm Terry Ann Jones from Ward 1. I don't have any fun facts. It's Northeast. I do have 3 churches within half a block of me.
You're well covered.
Yes,
Wow.
about over to Paul.
Yeah, Paul Pentel. I'm the Ward 7 rep. And let's see, Craig.
Yeah, I'm Craig Hedberg. I'm representing the School of Public Health at the University of Minnesota. And I don't know if there's anybody left or not.
I think we've got the health commissioner, if she's here.
I am here. Gretchen Musicant, Commissioner of Health for the City of Minneapolis.
There you are. Okay. Is there anyone else we missed who's a member? And then we've got Hattie Weisel, who's at organizing, who's also with the Minneapolis Health Department. Okay, so why don't we go through the other guests who I think may all know each other loosely. And if there's anyone left over, let us know. So should we start with Dr. Deborah Erdley?
Hello, I'm Dr. Deborah Erdley, and I teach public health nursing and nursing informatics at Metropolitan State University. And I just have to put a shout out for the University School of Public Health, which is where I took many classes for my doctorate in public health nursing. And it's a privilege to be here.
Nice. Thank you. Okay, anyone want to go next? Or Deborah, do you want to?
We should make sure that Christopher has a chance to introduce.
Oh, yes.
Yeah. Mm-hmm.
Yep. And how do we say that last name? That's a great last name.
Why don't we let Christopher tell us?
Yep.
And Christopher, you might be muted. I see a hand up. Maybe if you're able to unmute at some point, we'll stick your hand up and we'll make sure that we come back to you. Oh, mic is not working.
Okay.
All right. Well, we're so glad that you joined us. Thanks for coming.
Yes. Okay. All right. So I see Fadumo Ali. So I'm going to call on you next.
Hi, everyone. My name is Fadumo. I'm a nursing student at Metropolitan State University, and this is actually my last year in the BSN program. I'm looking forward to presenting to the committee, and I would like to thank you for having us students to present to you guys.
Thank you. Okay, Ali, Fadumo, would you like to call on someone?
I'll call on Huda.
Hi, my name is Huda Roderi. I'm also a senior BSN student at Metropolitan State University. Since we're speaking about wards, I'm from Summit University neighborhood in Ramsey County, so I'm not from Minneapolis. But yeah, I'm also excited to be here and excited to present to you guys as well. I choose Joanna to go next.
All right, I'm Joanna Wolf, another student of Professor Erdley's, and also a homeowner in Ward 1, another senior, and just excited to present this information to you all. So I choose Taylor to present next.
Hi, everyone. First off, I just want to thank you so much for having us. This is an honor to be here. My name is Taylor Nagel, and I'm also a senior year nursing student here at Metro State, and loving it and can't wait to graduate. So thank you again for having us all.
Thank you.
Oh, and then I'll nominate Christine to go next.
Okay.
Hi, I'm Christine Schlingman, also a senior year nursing student at Metro State. Excited to almost be done and get out there in the field. And also thank you guys for having us.
Thank you. Thank you. Okay, we'll give Christopher another chance. There he is.
Hey, can you guys hear me? Hey, everybody. Sorry about that. I denied permission for the things when I logged on, and then I couldn't undeny, but I figured it out. So okay. I'm Christopher Capan. That's how you pronounce it.
Capan. All right.
Yeah. And I live in Kingfield, and I'm happy to be here.
Great. Thank you. We're happy to have you. All right. Excellent. Look at that. So we have, I think we can go next to our presentation. We've got one presentation tonight from the lovely students who just did introductions for us. They are going to lead us through a presentation about a community assessment that they conducted as part of a class project this fall. Correct me if I'm wrong on that. And so normally we have you share your screen if one person is designated as a presenter. I can also probably share my screen as well and pull that up if that's needed.
We have one person designated to share if that's okay.
Oh, that's perfect. Great.
All right, Huda, if you want to do that, and then I can start us off.
It's just taking its time loading.
Alrighty, so I'll take it from here. Good evening. As you know, we're Professor Deborah Erdley students and part of the main nursing program at Metropolitan State University, and we're in our last year receiving our bachelor's in nursing coming this May. We're so pleased to present to you our community assessment project, and we're focusing on the Whittier neighborhood in Minneapolis. So our acknowledgements, we just want to say a special thanks to all of you on this call, and we appreciate your time and taking time out of your busy schedules to listen to our project. We want to say a special thanks to Margaret Schuster, members of the City of Minneapolis Public Health Advisory Committee, the Whittier Alliance, who have been really helpful in finding some information about our neighborhood, community members and stakeholders of the Whittier neighborhood, representatives of Ward 10, the mayor of Minneapolis and staff, as well as our professor, Dr. Deborah Erdley. So an overview of the community assessment project. The purpose of this project is to assess the community as a whole, kind of using that as our patient, as you'd say, and find the strengths and weaknesses in the community and come up with interventions to better the community, things we can do to strengthen it, as well as eliminate risk factors. So to collect the data, our primary data was collected through what is called a windshield survey. So we went out in groups of 2 to assess the community. And despite the pandemic, we were still able to get a lot of information and also gather that information safely by wearing our masks and social distancing from community members as well as other people in the community. And then we also conducted 6 key informant interviews, which were residents in the neighborhood, and we asked them a variety of questions and got their input on the community, what was going well in the community, what they thought of were the strengths, and what they thought were the weaknesses. And we'll go over some more of that data later. Also, we used secondary data collection, which was use of scientific literature and peer-reviewed articles to find accurate and complete data to help our data points. We also used the My Strengths, My Health app in collaboration with the University of Minnesota as a tool to organize our data and to understand unmet health needs of marginalized individuals in the community we are assessing.
So just some basics on our community of focus. Whittier is part of the Uptown District and includes the districts of the Lynn Lake area, Eat Street, and the Minneapolis Institute of Arts and MCAT areas. It's bordered by Franklin Avenue to the north, Lake Street to the south, Lyndale to the west, and 35W to the east. So the surrounding neighborhoods to our community would be the Phillips West neighborhood to the east, Stevens Square to the south, Lowry Hill to the west, and then the Lyndale neighborhood to the south. It's zoned into the Ward 10 district and is served by the 5th precinct of the Minneapolis Police Department. Zip codes in the neighborhood include 55404, 55405, and 55408. For our entry of data into the My Strengths, My Help app, we used 55408, but all of these neighborhoods can be investigated using that app's information. As explained prior, part of our data collection was made using the windshield survey, in which we went out into the community and investigated data and just used observation as our main point. We identified several strengths in the area, which included strong connections to the transit system and the Greenway bike system. The neighborhood has many zoned bike paths in the area, so like protected by cones that allow for safe bike commute transportation and access to the greenway at several points. It's also really convenient just getting on bike and exercise paths to the lakes and other areas in the city. There are also several green spaces available for public use in the neighborhood, including areas around the Whittier Community School and Park, and then the Washburn Fair Oaks Park. As you may be familiar, Eat Street has a rich diversity of ethnic markets and restaurants. And despite the pandemic going on, when we went through the neighborhood several times, it seemed to be full of operating businesses. The Good Grocer is another highlight on Eat Street or Nicollet Avenue, and it provides very affordable groceries and the ability for residents to volunteer to make change in food accessibility. So it's a real asset to the neighborhood in that it provides people who may not be able to access food affordably different options. Another noticeable feature of the Whittier neighborhood was the community engagement that we witnessed going on. We saw people actively engaged all over the community, whether that was shopping at the Carmel Mall and system or supporting local coffee shops and businesses on Lindale. That was just a very noticeable feature. Every time we were out in the community, we saw people supporting the local businesses. Thanks to the walkability of the neighborhood, residents can grocery shop, dine, buy clothing, home goods, all sorts of things right there in the neighborhood, and it's totally walkable. So conversely, there were some negative factors that we noted during our visits. At each bus stop that we investigated, as well as other areas on the sidewalk, there were a ton of discarded tobacco products. Cigarettes, tobacco sleeves. In some places we noticed burning garbage. It was just very evident in every bus stop that we visited. Going along with this, the neighborhood has several shops labeled directly as smoke shops. And the accessibility to these products is just really high. Traffic also was a big issue in the area, especially along Lindale, and it just, every time we visited, it was really congested. And just an issue at any time of day. Parking in the side streets was also pretty bad. It was really tight with cars, and that limited the visibility for car traffic as well as pedestrians. So although walkability in the neighborhood is great and convenient, it did not always feel safe when we were on foot to go through as pedestrians just because traffic was such an issue. The streets, especially along Lindale and Lake Street and near the Kmart, had noticeable amounts of garbage, including beer bottles, fast food wrappers, and lots of tobacco products again. There were garbage cans available, especially near the bus stops, but it seemed that they were frequently ignored, and garbage was just kind of on the sidewalks and in the along the curb on the street. And then lastly, affordable housing seemed to be another issue in the neighborhood as we were walking through. We did see new housing going up that was marked as affordable, but we also saw signs in people's yards that were demanding more affordable housing. And there were also 2 large homeless encampments that we noticed when we went through in September. So along the Greenway and then in the park, the Washburn Fair Oaks, that we noticed and it seemed to be an issue. There were also noticeable maintenance differences in some of the newer buildings versus the older duplexes and older buildings. So just looking at the demographics of Whittier, in 2019, the population of Minnesota was about 5.5 million, and the population of Minneapolis was about 435,000. When you look at the number of people that live in Whittier, it makes up about 3.3% of the population of Minneapolis. But given the size of the neighborhood, the population makes it one of the most densely populated areas of the city. And then again, going by statistical data from the Statistical Atlas and the Minnesota Compass, the most popular age group of people that live in Whittier is the young adult age group, which goes along with the people that we spoke with. Most of the residents we spoke to backed this up. They were newly out of college and had moved to the Uptown area after graduating college. The neighborhood also contains the MCAD college, so many of the students are present in the neighborhood at times. So that's kind of why we chose to focus on that for our age group. The neighborhood is over 50% white, with 41% being represented by people of color. When you look at that number, it's broken down into about 20% Hispanic and about 20% Black identifying residents. But that also includes notable populations of Native people, as well as a sizable amount of East African immigrants, mostly Somali, and they have ties to the Carmel Mall in the neighborhood. 20% of Whittier residents are foreign born, and the neighborhood is almost about even gender-wise, with just about 50% identifying as male.
After our neighborhood assessments, we have identified the top 3 health concerns in the Whittier community. The first health concern we have identified is tobacco use. During our windshield survey, as Joanna was saying, we have seen many individuals participating in tobacco use. This mostly occurred out in public spaces such as bus stops. Another identified health concern is the COVID-19 virus. This community has a high number of COVID cases. In addition to that, our group has witnessed many individuals without masks out in the community. Our final identified health concern is homelessness. Within this neighborhood, there are 2 large homeless encampment sites that Joanne has also previously mentioned. The number of homeless individuals has increased as the COVID-19 pandemic progressed. The health priority we have chosen is tobacco use among individuals aged 18 to 24 years old. It's convenient for these individuals to purchase and consume tobacco products due to the fact that there are several smoke shops situated in this neighborhood. This is a very important health topic to address due to the detrimental health consequences smoking can lead to. This includes lung cancer and chronic obstructive pulmonary disorder, or COPD. Research states that the individuals who smoke are 12 to 13 times more likely to die of COPD compared to non-smokers. Smoking has also been noted by the FDA that it can make these individuals more vulnerable to the COVID-19 virus. Encouraging smokers to stop smoking is one way we can improve the overall health of this community. When compared to the rest of the city of Minneapolis, the tobacco use prevalence in adults residing in the Whittier community was at 21.4% in 2017 in the 55404 area code. Tobacco other 2 zip codes were about 18%. Whereas in the rest of the city of Minneapolis, that number has dropped from 15.3% of the population used tobacco to a total of 8.5% by 2018. Although this number has decreased, the number of e-cigarette users has nearly doubled at the same time. The Omaha System Problem Classification Scheme is a research-based comprehensive classification system that exists in the public domain. It's designed to enhance practice, information management, and documentation. It provided us a structure to record the needs and strengths of this community. We applied the system and chose our domain to be health-related behaviors. The problem we are addressing is substance abuse in regards to social smoking, and the signs and symptoms of this issue is smoking and using tobacco products. We have identified the population most at risk in Whittier to be young adults aged 18 to 24 who smoke tobacco products.
To better understand how tobacco use impacts the population at risk, we will first look at health determinants. Determinants of health are factors such as biological, behavioral, physical, environmental, and social environment that influence an individual health status positively or negatively. On many occasions, the negative influence these factors have on an individual is modifiable. The first determinant of health I'll be going to be addressing is biological. Evidence indicates that racial and socioeconomic differences in environmental factors may generate substance misuse, including access to and exposure to drugs of abuse, disadvantage and disturbance in the community, and barriers to care in the environment lead to reported health disparities in rates of drug use, disorders, and outcomes of treatment. An individual who suffers from mental and physical health conditions, such as depression, panic disorders, anxiety, and asthma, can be at greater risk of tobacco use. Family history of tobacco use, is also a contributing factor. Growing up in a household that tolerated tobacco use can minimize an individual's perception of the dangers of tobacco use. Some of the protective factors go hand in hand with the risk factors. As we identified how family history could influence tobacco use, no family history of tobacco use can deter an individual from using tobacco. When it comes to mental illness, someone who does not have any mental illness is less likely to use tobacco as a coping mechanism. You can't influence the home environment an individual is born into or their race and ethnicity, but providing educational resources regarding the health risks of tobacco use is something we can. Also, giving education to the community regarding prenatal substance use. Studies found complications during pregnancy, low birth weight, premature birth, and sudden infant death syndrome, SIDS, are all health issues smoking can bring to a pregnant woman. Providing these educational resources will positively influence reducing tobacco exposure at a young age and keep families well informed about the risk associated with tobacco use. The second health determinant I'll be addressing is behavioral. Tobacco has many influences, such as if a parent or guardian smokes, if an individual has low self-esteem, or if there's easy access to tobacco. Culture can also be seen as a risk to individuals, as some cultures promote the use of cigarettes. Protective factors such as health-seeking behaviors can help individuals to avoid the use of tobacco. In addition to that, religion is also a protective factor. For example, my Islamic faith advises me against consuming anything that is detrimental to my health. Having a strong, positive relationship with family or peers is a significant protective factor in avoiding tobacco use and a support system to rely on when trying to stop tobacco use. The third health determinant I'll be addressing is physical environmental. Whittier neighborhood is nicknamed Eat Street, is known for its many diverse restaurants, coffee shops, bars, Carmel Village, and Asian markets. While all the diversity in food and drinks is positive, it can also contribute to individuals participating in social smoking, especially in bars on Lindale. When my group members and I went out to the neighborhood, we noticed tobacco shops and many people smoking and vaping. Exposure to secondhand smoke in the workplace and living areas is also a risk factor. Protective factors include smoke-free green space. New Way House is a nonprofit organization serving the Whittier neighborhood, providing drug and alcohol treatment. Sliding fee scale, which is reducing the prices of services for individuals on lower incomes, are being offered at the Whittier Clinic. Work sites that enforce anti-tobacco laws and non-smoking environments are effective protective factors. And lastly, I'll be addressing social environment. Social settings such as clubs and parties that influence the use of tobacco. Smoking commonly occurs in social settings because people want to feel comfortable in those settings, such as hanging out with their friends. In these settings, alcohol can also influence smoking activity. As I stated, some cultures promote tobacco use, and this can support the normalization of social smoking. Lack of enforcement of smoking regulations, domestic violence, dysfunctional home life can also contribute to tobacco use. There are a couple protective factors that can help reduce these risk factors in social settings, including the availability of tobacco cessation programs to prevent and reduce tobacco use. Anti-smoking campaigns help spread awareness about tobacco use risk factors, non-smoking home environment in preventing secondhand smoke, also positive lifestyle among peers, and no smoking laws that are enforced.
As a summary, looking at the health of this community, we identified multiple factors in tobacco use among the age group of 18 to 24 years old. Protective factors help limit those from developing the habit. These factors include if individuals have grown up in smoke-free environments, if they actively participate in health-seeking behaviors such as exercise or preventative health visits, work sites where community members are employed enforcing smoke-free laws, and a peer group that does not participate in tobacco use. These protective factors can enhance by education, enforcement of policies, and increased awareness and altered attitude on tobacco use. Risk factors make individuals more likely to develop a smoking habit. A big risk factor, especially during the stress of COVID pandemic, is an individual's mental and physical health state. Since tobacco use can be an unhealthy way to deal with stress. An individual may be more tempted to use tobacco with the increased amount of stress due to COVID-19. Self-esteem and perceived self-worth also factor in as risk factors. The physical environment observed during our windshield survey can also put one at risk. We witnessed smoking outside bars and at bus stops. Additionally, instability or dysfunction in a home life can be a risk factor. The age of our selected population, 18 to 24, is in a transitional period in life, and their living situation may be unstable. Data from the Minnesota Compass shows that most residents in the area are renters, and many in this population of 18 to 24 may not be established in home or career yet. COVID-19 only adds to this insecurity. Our suggested interventions aim to lessen these risk factors in the community, reduce the rate of smoking, and promote an overall healthier environment for the neighborhood. On a policy level, working by advocating for change by way of increasing tax on tobacco products and also enforcing smoke-free areas in and around places such as buildings, restaurants, and public spaces to discourage the use of tobacco products. We also found that enhanced warning labels on products work to discourage the use of tobacco as well. Next, the use of social media works by advocating through mass reach health communication campaigns. This includes TV, radio, broadcast, print media, billboards, and digital media, and as well as other community interventions. Lastly, making sure there is adequate education and resources on smoking cessation therapy available to the community members, along with tobacco quit lines and referrals to community cessation programs. This concludes our presentation, and we want to thank everyone for their attention again, and a special thanks to Margaret Schuster and members of the Minneapolis City Public Health Advisory Committee, the Whittier Alliance community members and stakeholders for the Whittier neighborhood, and last but not least, our professor, Deborah Erdley. I would now like to open up the floor for any questions, comments, or concerns.
Wonderful, thank you. That was a very interesting presentation. I loved it. It's very interesting. I'll just open it up again if people have any questions, comments, or feedback that they'd like to share. We can. I don't think we need to use the chat if you want to jump in. If it gets to be too rowdy, we'll try to restore some order. But
sure, I have a quick. Someone else has their hand up already, but then call me after.
Okay. Excellent. Yep. So we can go. All right. So it looks like Britt, you've got your hand up.
I beat you to the punch, Jerome. Sorry.
Maybe we'll do raising hands if you can do that. Yeah.
I mean, it seems like a decent way to keep some semblance of order.
Yeah.
So, and of course, I lost my train of thought. A couple of things, though. I did see just, housekeeping stuff. I noticed that you were referring to the substance abuse. And I'm an alcohol and drug counselor. I work over at HCMC, and I would just encourage people coming into any sort of field where we're going to be working with folks who use drugs to try to get away from some of the more stigmatizing language like abuse. And we call it's people who use drugs and substance use disorder. So it just felt like a good learning opportunity. And a lot of the treatment centers like New Way, they do still allow for smoking tobacco. There's 3 that I believe are CARF accredited for being tobacco free, and one is Avivo, which is near that neighborhood. The other one's People Incorporated Huss Center for Recovery and all the other Peopling properties, and I believe that the third one is Mental Health Resources. As far as I know, New Way in and of itself does still allow tobacco use on property, but most of the substance use treatment centers do offer support with tobacco cessation if that is what the person is interested in. I think that's all I have right now. I think I was just interested that it was more of a focus on tobacco use and less on other public health crises like homelessness, because we see a lot more complex conditions and high utilization of hospital resources coming from that. Jerome, I think you're next.
Yes, thank you. I had a question just regarding the data. I think I got an implication from the presentation that proximity to bars and areas that allow smoking might lead to someone becoming a smoker or someone who smokes. Was that supported by your data, or is that just something I was pulling out myself?
So I think that was something that was supported by secondary data that we, just through our interviews and people talking with residents of the neighborhood. And that was just kind of an experience that we got through that data, and then also noticed the number of people smoking outside of the bars still with COVID going on.
Thank you. That was interesting.
Okay. I think that's it for raised hands. Oh, we have Dr. Erdley. You're next.
Speaking of key informant interviews, I would like to hear a little bit more about what you learned from those interviews. What did people in the community talk about in the interviews?
So in our interview, the key informants that we interviewed really stressed that they really loved the sense of community that they felt in the community, as well as the they loved each street, the diverse food groups. Yeah, they felt safe in the neighborhood. They enjoyed living there for the most part.
Other comments from the interviews?
Both of the interviews that I conducted, I think one was with Taylor, they worked in the service industry. So right now, I think they're out of jobs. And I think that's also why we were linking this to the stress and coping issue with COVID going on right now, just because it is a time where these people are out of jobs and things are stressful. And even if you're not like an inherent drug user or something like that, it's just ramping up with the additional stress and just experiencing this all as somebody who works in the industry, in the neighborhood. One of our informants, for example, lived and worked in the neighborhood and basically like walked everywhere. And we found that especially interesting that they were able to just have such a small community group that they felt comfortable in, but also they're impacted by everything going on.
And then just to put this out there, the students were given the option to select a public health priority that they felt passionate about. Mm-hmm. And so they selected tobacco use because that is an area that they are all very concerned about. And homelessness definitely was addressed, but they were given the liberty to select a top public health priority that was of interest to them as well. Thank you.
Yeah, thank you for that. That's great. Erin, you're next, and then after you, we've got, well, Britt, she just, I think, put her hand down. So Erin, you're up next. Britt put her hand back up.
Yeah,
Britt,
so you mentioned slightly different than the tobacco cessation, but you mentioned the level of trash along Lake Street and some of the busier streets in that area. You know, I guess what effect did you think that had on the community? Do you think that, you know, I kind of come from a legal background. I learned about broken windows theory, which has its own criticisms, but the idea that cleaning up neighborhoods shows that people care, leads to better mental health, people take care of things better. You know, I guess I'm curious to hear your response to that idea and the impressions that you gathered from community members regarding the graffiti and trash.
Well, I will start by saying I think it's a little, comparing it to downtown where like the DID kind of takes care of some of that, the Minneapolis, it is striking how much more trash is accumulated along the Lake Street area and just on those blocks. I have family that live in the Lindale area and they, like even just crossing south, it's noticeably different than it is in the Whittier neighborhood. So I think it is noticeable. And I think like going through there, it's like the first thing that your eyes notice when you're going through that area. And it is just good or bad. Like you just notice it being there.
Okay. I'm guessing, Dr. Erdley, you wanted to respond to that, or did you have another?
Just, just briefly, please. Erin, you raise a really good point. And we know from recent research that environment has more impact on health outcomes than genetics. So if one is living in a neighborhood where there is trash, which of course can contain bacteria and other unhealthy and unhappy biological elements, that will impact their mental health in some way, shape, or form. We have research to support that. And I'll mute myself now.
Okay. Thank you. Thank you for that question, Erin, and for the answers. Okay, Britt, you're up next.
I think that whole piece about the DID and the visible trash is really interesting. And one of the things that I noticed, because I live right off of East Lake Street, really close to 3rd Precinct. So after the uprising happened in our neighborhood, it was a community effort to clean up. And, you know, it's still not 100%, but it was a lot of community effort to clean up and take care of each other. And it took a lot longer for it to clean up. And then what we noticed was after that kind of mini riot over in downtown in August, it was pretty much cleaned up right away and they had professionals boarding it up. So it just doesn't, sometimes it sends a mixed message to certain neighborhoods where you're not getting that same support in cleaning up your own neighborhood. So I thought that was an interesting point. Another thing too is it was an interesting thing to bring up the service industry and the higher likelihood of smoking tobacco. And so my spouse is service industry. Several of my friends are service industry. And one of the things that I've noticed in my career, as well as my personal connections, is working service industry, most places don't have access to insurance. You're not going to get a health plan where you work. And if they do offer a health plan, they're usually going to schedule you fewer hours so they don't have to offer it. And considering the wages in service industry, people start to become too rich for Medicaid type plans, but they can't afford the exchange. So substance use disorder is rampant in service industry with excessive drinking, excessive drug use, and of course, chain smoking. And the folks who work in service industry, other than being surrounded by the culture, have fewer resources to access if they wanted to get help for their mental health or substance use. And for my final thing, it's a question. Did you notice, what were your findings on the density of the Whittier neighborhood? Because it is super dense, like tons of apartments, tons of duplexes, fourplexes, and new developments coming up with the East Street and the bars and people just being so close together. Do you think that the density also had impact on the spread of COVID-19 and also the behaviors of course, gathering in bars and smoking and not having your masks up, but, you know, just being so close together and not having the environment to create that physical distance? I'll mute myself.
Is there a desire for a response, or if you, from the presenters, if you'd like to raise your hand? Otherwise, we do have another.
I did have a question about density.
Oh yeah, sorry. Apologies.
I think the density.
I ended with a question.
Yeah. Yep.
Yeah, definitely a big part of it. We even saw people like congregating in groups, just with the apartments being so packed. You know, like a lot of 4-plexes, 5-plexes, things like that in the neighborhood. It is one of the most densest neighborhoods in Minneapolis, and I think that, especially with the age group that we're looking at, this is what's increasing in COVID right now too, and just choices that are being made and socialization and everything going on, it definitely contributes to that.
I think I'd like to add a little bit to that too. Britt, I just want to thank you for correcting us on what the correct term is. That's important, I think. And yeah, I just wanted to thank you for that. As well as congregating around the bus stops, we saw a lot of smoking as well as people not using a mask. So I think it's also like access to, like, you know, if you're driving a car compared to riding the bus, you're probably more likely to be exposed to secondhand smoke.
Okay. Okay, Jerome, you're up.
Thank you. This is a really quick note, and I'm not sure if this is emerging or not. But just last month, we heard from the city's Department of Racial Equity. And in their racial equity analysis and suggestions, they suggest that you disaggregate your data, particularly when it has to do with demographic data, as much as possible so people can really pull out the detail. And, you know, slides are free. So if you have access to that disaggregated data, I think it would only enrich your presentation.
Thank you for that.
Absolutely.
Yeah, I totally agree with you. So thank you for that.
The students were on a timeline and were pretty much constantly in motion with this large benchmark assignment that they only had 12 weeks to complete. Your comments are so appreciated. Thank you.
Yeah, thank you. Thank you for coming and presenting. Very good information. Okay, so I see no other hands raised. I think we're ready to move to the next item on our agenda. So again, thank you so much to our presenters. That's our last presentation for the year. So, and up next, I think we've got the presentation of certificates to outgoing committee members. So Margaret, you and I are going to share that portion. And to the presenters, you are welcome to stay for the entire meeting if you'd like. We will not feel hurt if you decide that you would like to drop and have dinner or whatever it is you need to do for the evening.
Really great to meet all of you, though. Thank you so much. For anybody who is visible, we can give you a little round of applause. Thank you.
Thank you. Nice job.
So Kathy, do you want me to start it off in terms of the certificates of recognition? And give a little blurb about it?
Yes.
Okay.
Yes. I got to get at the language that you sent me.
Yeah, sounds good. So I had explained to our guests that people who are appointed to the committee serve in 2-year terms and can serve a maximum of 3 2-year terms. So your maximum amount of time that you are eligible to be a part of the committee is 6 years. And some people are appointed in sort of midterm because maybe someone was in their seat and then they left and someone comes in. So you might not always reach exactly 6 years, but 3 terms are the maximum. And tonight we have 5 outgoing committee members, 4 of whom have reached their, or 3 of whom have reached their 6-year limit. And so, so we want to give a shout out, and normally we do that by way of certificate of recognition. So I will ask Gretchen actually to start by reading Johanna Berry's certificate of recognition.
Yes, thank you. And we already heard from Johanna how she feels about leaving, and we feel the same about her leaving as well. Just a point of reference, some of you may or may not know, way before I came to the health department as a staff person, I was on the Public Health Advisory Committee, and I served out my 6 year, my full terms until it was time for me to move on as well. So I think back fondly to that. So let me tell you about Johanna. Johanna served as the Ward 5 representative for 3 consecutive terms. She owned the depth of her lived experience and brought her insights into every committee discussion. Johanna gently but firmly pressed committee members and presenters to connect information to the reality of people's experiences. She asked the most relevant questions. So what? What does this mean for me, my family, my neighborhood, and the people across the city? During her tenure, the PHAC proposed the development of a housing advisory committee, supported ordinance changes to limit access to tobacco products, including e-cigarettes and flavored tobacco for youth under 21, paid sick and safe time, and increased access to healthy food. Most recently, she participated in and supported the development of guidelines to eliminate lead poisoning for children living in Minneapolis. Thank you so much for bringing yourself and all that you know about the community and the people who live in Minneapolis to this work. Thank you.
Thank you, guys. I have very, very much enjoyed my time. Thank you so much.
Thank you. Margaret, you're on mute.
Yeah, Johanna, thank you so much for all the time that you devoted to our meetings. Definitely, you will be missed. Kathy, I think you'll be up next and reading Paul Pentel's certificate of recognition. Paul was eligible for a third term and had decided that he was not going to be put in an application, which is totally an individual decision. And so we want to honor you, Paul, and Kathy's going to read the certificate.
Great. I'm honored to read the certificate. And I think, Paul, you've put in, I think what we get 6 years total. I think you've put in 10 years in the time that you've been on the committee. So I just want to say that personally, I'm very appreciative of that. So here's what your certificate says. So this certificate of recognition is awarded to Paul Pentel for his service on the City of Minneapolis Public Health Advisory Committee as the Ward 7 representative for Councilmember Lisa Goodman. Paul has been a quiet, consistent, and persistent presence on the Public Health Advisory Committee for 2 terms as the Ward 7 representative. His medical background added breadth and depth to committee discussions on air quality, environmental toxins, tobacco use, and recycled tire mulch in Minneapolis playgrounds. His passion for correcting the negative impacts of lead poisoning on the children of Minneapolis resulted in the development of a subcommittee to study these impacts, identify the most affected areas and homes, and create a set of guidelines to address them. He most recently presented these guidelines to City Council members on the Public Health and Safety Committee. Paul's leadership and tenacity enhanced the quality of the work of the committee and held fast to his commitment to addressing health concerns for all people living in Minneapolis. Thank you, Paul.
Kind words, appreciate it.
Yes. Yeah.
Thank you so much, Paul, for your time with us on the committee. And again, you will definitely be missed as well.
Yes.
And Jerome, I think you are up next to read Kathy Tuzinski's certificate of recognition.
This certificate of recognition is awarded to Kathy Tuzinski for her years of service to the City of Minneapolis Public Health Advisory Committee as the Ward 13 representative for Council Member Lene Palmisano. Kathy served as the Ward 13 representative for 3 consecutive terms, serving as the co-chair of the committee for the last 2 years. Committee discussions and actions were enriched by her skills in statistical analysis, survey design, team collaboration, her quiet yet thorough demeanor, and steady leadership. Kathy is passionate about improving the health of the community by viewing public health as a system of interconnected elements. During Kathy's tenure, the committee supported ordinance changes for paid sick and safe time, increased access to healthy food, and limiting access to tobacco products, including e-cigs and flavored tobacco for youth under 21. She provided feedback on the state health assessment and participated in developing the guidelines to eliminate lead poisoning for children living in Minneapolis. Most recently, Kathy authored the PHAC letter of support to the City Council for declaring racism a public health emergency. Thank you, Kathy.
Thank you.
Thank you, Kathy. It's been such a pleasure to get to know you. So glad that you stuck with us through
I
these
am
6
too.
years.
Yeah. You kept pulling me back in. But I am so glad I stayed. It's been a very worthwhile experience, and I will remember it forever. So I'm going to be looking at videos of you guys next year.
Excellent. Sounds good. And I will go next with a certificate for Yolanda Adams Lee. And then after I read Yolanda's, Kathy, I'll have you read Angela's. So this certificate of recognition is awarded to Yolanda Adams Lee for her 6 years of service on the City of Minneapolis Public Health Advisory Committee as member at large. Yolanda has a deep well of professional experience, personal knowledge, and the kind of wisdom that comes from both joy and pain. Her years of work on affordable housing, homelessness, and equity in renting added depth and reality to the PHAC recommendation to establish a housing advisory committee. She understood the need to inform, connect, and engage city leadership at the policy level, especially on public health issues. Yolanda served as the PHAC liaison to the North Side Green Zone Committee, significantly influenced their community engagement efforts, and dedicated Green Zone funding to promoting healing circles for North Side community healing. As a member at large, she supported other committee actions to limit access to flavored tobacco, e-cigs, and other tobacco products for youth under the age of 21, increase access to healthy food and provide paid sick and safe time, and most recently, the development of guidelines to eliminate lead poisoning for children in Minneapolis. And so although Yolanda wasn't able to join us tonight, we salute and honor her presence among us these many years.
Mm-hmm. Yeah, hear, hear.
All right, Kathy, do you want to read Angela's?
Yes. Well, can we preface this with saying, so she started, Angela, you started 2 years ago, but now you're, well, was it 2 years ago? When did you start on the PHAC?
Yep, 2 years.
Yeah. And it seems so soon that you're off, but I think it's because you have to be, right?
Yes.
Yeah. Okay.
I was in more of a transitional role. I'm no longer really with Hennepin County Public Health Department, and they've hired my replacement now, who's going to be fantastic. So this will be a good
hopefully as fantastic as
you're too
been.
Yeah.
I mean, I've not known you for a very long time, but I feel like I know you, and I don't know why that is, but you're just a wonderful person. So I'm going to miss you on the committee, but I'm also not going to be on the committee either. So maybe I will see you downtown someday.
COVID made us all close in many distant and remote ways, but I think we all were called to serve, and it's been a great experience. So thank you.
Yes, good, good. Okay, so I've got the privilege of reading off this certificate for you. So this is awarded to Angela Watts for her years of service on the City of Minneapolis Public Health Advisory Committee as the member representative for Hennepin County Human Services and Public Health. Angela joined the Public Health Advisory Committee 2 years ago as the member representative for Hennepin County Public Health and Human Services. Her years of experience working in the fields of public health, early childhood education, and social work brought breadth and depth to many committee discussions. She's a fierce advocate for public health programs, eliminating disparities, and improving outcomes for families with children birth through age 24. During her tenure, the PHAC studied the health effects of 5G technology and finalized the guidelines to eliminate lead poisoning for children living in Minneapolis. And I feel like there was so much more that was done.
Yeah.
Yeah.
We survived COVID together. That's the biggest accomplishment. So I'm really excited for the new members who are going to come in a post-COVID time and really do some exciting things. So always available for your for any kind of consultation, expertise, or continued collaboration.
Wonderful.
Sounds great. And I think, Angela, you and I talked about when you maybe sometime next year being able to come in and talk about Red Leaf Family Center. Yeah, and be
So
able
I've
to
been
give us
building
a
a new building
presentation.
during the COVID pandemic, and it'll be open and ready in February. So
wow,
happy to share what that's about and give you a presentation.
Sounds fantastic. So for all of our outgoing members, Hattie will put the certificates into one of the certificate holders, and then we'll actually mail them to you. Sorry, excuse my throat. And she may be reaching out to you just to make sure that we have an accurate home address so that we can drop that in the mail, and you will be receiving that. So a parting gift from all of us to you. Right. Great.
Hey. All right, on to the report section of the agenda. And so we've switched things around. We're going to talk about the lead presentation. And so I'll just kind of give a quick update context before, I think, Jerome, you wanted to maybe lead a discussion there? Or, okay. So, well, as you may all know, Jerome and Mary Pike and Paul Pentel, they provided, I would say, a stirring and solidly informed presentation to the Public Health and Safety Committee last week about why and how to boost our efforts as a city to prevent lead poisoning in children. And I'm just curious if anyone else had caught the presentation and if they had any thoughts on it that they'd like to share with everybody else or with the speakers.
Well, I already sent an email to all of them. It's so appreciative. It was a very powerful presentation. And I think what really nailed it or expressed my feelings so well was when I saw something from Lisa Smested, who said that she was reinvigorated or moved to new levels of commitment to the topic. And she's somebody who's given her heart and soul to this for 15 or more years. So it really was a fantastic presentation, just full of data, clear recommendation, but also heartfelt reasons why people should care. So thank you so much.
Yeah. Wonderful.
Yeah,
go ahead, Margaret.
I'll second that as well, as that Lisa was emailing me while you were all presenting, and she was just really moved in terms of feeling, I think, like, within the department and certainly within the families who are helped by the lead work that she does, she feels affirmed by that. But I think she felt especially lifted up and affirmed in the work that she's been doing for so long by hearing an independent body talk about it so passionately and so articulately and so accurately, is just, I think that's really what just struck her heart. So she was sending me emails to just say exactly that, how thankful she was that the three of you had been able to get up there and give such a moving presentation.
Yeah, definitely. Yeah, and I think what Philippe Cunningham said too, a little bit of his commentary afterwards is really affirming and validating as well. How it was linked to public safety as well, the lead poisoning.
Oh, definitely. Yeah.
I completely agree. It was a really rewarding experience getting to being able to help deliver some of the recommendations and the research and some of the work that I know Paul and Mary and the other committee members have really put into it, right? Now I think just as co-chair, right, I'm always looking ahead. I'm like, well, so in 2021, what are we going to have on the agenda? And I think it's a really great opportunity to really get into what it takes to bring a set of recommendations from the committee to reality, right? Because I'm not sure that any of us on the committee have an idea as to the nuts and bolts required to, is it just the comprehensive strategy that we suggested, or is it getting the coordinated position hired? You know, what comes next after the presentation is received and filed by that committee? I have no idea, but it'll remain on the agenda until we figure it out, I think.
Yeah, and Gretchen, I don't know if you've had any follow-up conversation with Patrick. Certainly Patrick Hanlon, you know, one of the directors for the health department, made some comments, I think, at the end in terms of how that action might move forward. Have you heard anything further from him, Gretchen? Or obviously it just happened a couple weeks ago, so.
Yeah, no, I don't have any new specifics. So hopefully we'll be able to get the position approved. I think with the kind of testimony that PHAC just gave, even though there's a hiring freeze, if we need, you know, approval, we should be able to cite that presentation and recommendation to move forward. I guess one thing that comes to my mind about a role for the PHAC is that position is a tiny little bit of the recommendation. It doesn't get us all the way. And so I think that that's an important role for PHAC to, you know, evaluate, figure out, you know, how far did we get with that? How does that compare to what the recommendations were? How else can we nudge things forward and bring that attention to the policymakers?
I completely agree. And even as you say that, you know, the recommendations that we gave it really was just for a small part of a wider geography that we know was suffering from exposure to this same toxin. So that's certainly something we need to keep our eye on.
I think in one of the conversations that I'd had with Patrick and Lisa, and I'll go back to them and ask this question specifically, was whether it would be appropriate to give this presentation to the housing committee, which I think is headed up by Cam Gordon. Isn't that right, Gretchen? You know, or it used to be.
Yeah,
anyway.
getting a little puzzled look on my face because I can't remember since COVID came and we got rid of all the committees.
Yeah.
I don't remember that. And we were just down to like one committee, and now we built back up to a few committees, but they're different. So I've lost track of what happened to the housing committee. But yes, when it was pre-COVID, it was certainly the committee that was chaired by Councilmember Gordon, and he is not on the public health and safety committee, so he didn't hear this presentation.
Yeah.
So we should find out where he is on what committee and
Most
figure
definitely.
out a way to share that with him.
Yeah, so I'll circle back as well with Patrick and Lisa, because I had explained to Paul and Jerome and Mary after the presentation that often after a presentation is received and filed, that it does come back to maybe a point person within the staff, you know, as the subject matter experts, to find out what are the next steps, you know, that PHAC, you know, can take or help support, or, you know, whatever it is that action could be taken. So I'll go back to Patrick and Lisa and have that conversation with them. But I know there was a point at which we sent off the lead recommendations to the Housing Advisory Committee, And I believe that the Housing Advisory Committee and our leadership had a conversation. Did that conversation happen? Or was that scheduled and it got canceled? Does anybody remember?
I feel like I've been in that room, that's the ante room next to the council chambers, talking about this. With some of you, Council Member Gordon, for sure. So
yeah. So that may be another link between the Public Health Advisory Committee and the Housing Advisory Committee, is to be able to circle back with them and say, hey, is now the time to be able to come back to your committee and share this more deeply. So those are at least a couple of immediate actions that we can take.
One thing
I want to chime in that Cam Gordon, I know that I've primed him for this conversation on multiple times. So just to echo that, yeah, we should definitely take it to his committee as he would be ready to receive this for sure.
Great, thank you.
I do think we don't really lean on committee members enough to take work back to their appointing council people. And so this could be a really great presentation, committee members, to take to your council person, just so that when we then circle back around for future discussions, they're already warmed up, like KJ was mentioning.
Yeah, in the past, we have had some folks on the committee, sometimes it's been me, sometimes it's been others, who have, like just created almost like a little blurb even, that it's like, so this is what happened at our Public Health Advisory Committee meeting last night, and send it out to all of the committee members, and then the committee members can forward that right on to their council member to say, hey, we had this committee meeting last night and here's what we did. So it might have like 3 bullet points or something, generally pretty short, but it at least creates that circle between the committee members and their council member and our committee and the work that it's doing. I see Paul has a hand up.
Yeah, Gretchen, maybe you can help me with this. You recall we met with informally with Cunningham and Gordon before COVID, and we're interested, and as I understood it, they had suggested present to the committee, which of course got postponed for a while, and said that at that time they would come back and ask the health department to come up with a more detailed plan for how this might work. And that didn't come up at this meeting. So I'm just kind of surprised, because I thought that was the next step, other than talking it up and trying to get more interest, but apparently that's not being considered at the moment.
Oh, it's probably just been such a long time and there's so much on their plate that, they forgot that previous idea. And so that's why I'm thinking that this committee, your committee, can kind of take the job of, okay, let's get that position filled. Let's see what it can do. Let's bring that forward. And at that point, have another meeting potentially with the champions, the council member champions, and say, okay, the city's made some investment in this, but we're not moving fast enough. We only doubled the number of houses and we should have tripled them, or I don't know what the metric is, but I think that would be the way, especially let us get some work done while COVID is kind of calming down, and then, later in 2021, be able to bring it back up with some evidence of effectiveness, but maybe not sufficient or something like that. I think that'd be a way to bring it back in to where Paul, you thought it might be.
Yeah, and that is definitely something that we had to do with the Housing Advisory Committee. So even after we had made a recommendation for it to be established, you know, we really, as a committee, needed to stay committed to that idea and to the solution that we had proposed, and circle back to it in 3 different annual reports that were given to the city council until finally it was like, okay, we hear you. And then there was action, you know, in terms of what would this look like? How would that, you know, how would a housing advisory committee actually get established? Who would be on it? And I know KJ was one of the primary authors. Sarah Jane and Cindy Hillier, you know, were also primary authors of at least a document that got presented to them to say, here's what we think as Public Health Advisory Committee as to how this committee could be established. And then lo and behold, it was. So I think, yeah, I think it's hard to hear that the council members, you know, took this report and they're just going to file it away. But it's really sort of a continued call to action, you know, for us as a committee to stay committed to, you know, the guidelines that were created and to be able to, yeah, have those conversations going forward. And then Patrick and Lisa may have some additional ideas as well.
It's so great that you mentioned the housing committee and the former committee members, former PHAC committee members that were involved in it. And during this meeting, right, when people are, you know, contemplating moving on to something else, and I'm saying, no, you're going to stay involved with Public Health Committee. Another Kathy, Paul.
Let me know.
Those are just the names on my screen. So very, very well timed. Thank you. Thank you for that. I'm excited to keep pushing because it's a worthy goal for sure.
Excellent. Okay, are we ready to hear from Gretchen? Okay, excellent. All right, so next up we have the update from Commissioner Musicant.
Thank you. I thought I'd talk about 3 things. Just touch on them anyway, and then you can ask me for more if you want more. Certainly talk about COVID. Talk about budget. It's budget season for the city council to be making some decisions in the next couple of weeks, and then a little bit about reimagining public safety, which is now the community engagement piece of it anyway is now the health department's job. So, so starting with COVID, we continue to do testing. We purchased the new saliva tests we purchased with CARES dollars before they expired. We had to spend our CARES dollars from the federal government by November 15th. And so we pre-purchased some saliva tests, and we're planning to bring those into parts of the community that aren't reached by some of the other mechanisms that are available. And so just pulling that idea together, we're actually this weekend having a community testing event. We've also had to transition from what had been an outdoor activity to an indoor activity. And so really the saliva tests come at a good time because it's a little less intensive and doesn't aerosolize things. And we're also with quite a bit of intention moving forward with vaccine planning, and that's taking a couple, there's 2 pieces. I don't want to say they're forks in the road, but there's 2 things to focus on. One is certainly thinking about when this vaccine comes, how are we going to get it to the top priority people? You know, do we have the right kind of coolers? You know, what kind of spaces are we going to need? What kind of folks to give shots? Who are our partners? We know that healthcare providers in long-term care are going to be a group that isn't taken care of yet, that's going to fall to us to figure out, maybe not necessarily do the shots, but how are the shots going to be delivered very early on for that group. And then we'll be looking at some of our first responders within the city as a second priority, but coming shortly thereafter. The second strand of our vaccine planning is really to think about vaccine hesitancy and think about communities and what will it take for them to feel like they have enough information to trust this opportunity to protect themselves from COVID. And so we're using a process that's very similar to what we used early in the outbreak when we had the Shared Power Advisory Committee. And so we've reconvened a number of those folks. We are also taken to the airways of radio stations that serve culturally specific groups and linguistically specific groups to talk about kind of call-in shows so people can get their questions answered. We're going out and talking to groups. And we hope that we will get a sense of discovering together information about the vaccine. So it's not, we won't be in a position of trying to sell from the experts in the health department, but learn together and develop community ambassadors that can help share that knowledge that they have gained along with us. So the third item I wanted to talk about with COVID is the mayor continues to be concerned, as we all are, about the rising cases, wants to make sure that he's using his executive power to its fullest extent. The most recent directive from the governor has pretty much covered a lot of the waterfront in terms of things that we might be concerned about at the city. The governor's action is only for 4 weeks, and so we are in conversations. If the governor doesn't extend it on December 18th, we don't think it's wise to all get together and party over the holidays. We probably won't be ready for that, and so we're just getting ready to help the mayor extend that. Portions of it anyway, if needed, if the governor doesn't extend it. So just thinking ahead as we continue to do contact tracing, which is becoming, it feels we're doing tons of contact tracing, but we're still only reaching about half of the people who are infected now. And that's true across the entire state. The volume is just so high. And so we have continued to look for repurposing our own staff and bringing in others to be trained and to help. But it gets to the point where you wonder, is this making enough of a difference if we're reaching only half the folks? And so thinking of lots of other strategies to make sure that people know what they're supposed to do if they get a positive test, even if they don't get called right away. And then hopefully with these actions that the governor took, bending the curve down a little bit so we can get back to a more reasonable number and reach, closer to 100% of the folks with our contact tracing. So that's it for COVID, or those are the highlights that I thought of. In terms of the budget, I'm not sure how the budget conversations are going to go, but the city council is quite interested in turning over more stuff to the health department. Let me put it that way. So
Margaret,
we'll just be watching with our notepad and our pens. We've been in conversations in the last week or two, creating some greater capacity within the health department to address the needs of homeless persons. There is some COVID-related CARES money that can be used that's different than the other CARES money I was talking about, but that can be used through 2022. It's connected to something called Community Development Block Grant dollars. And so we're looking at whether or not some of that money can be allocated to the department so that we can be more prepared even than we have been to help folks. There's also a report that came out of the city coordinator's office that they had been working on for more than a year, looking at what kind of 911 calls could be handled by someone other than a police officer. And so the area of mental health is one of those areas that's been identified. And again, conversations that you'd think with the budget just a couple weeks away, we would be much more concrete in these conversations than they are, but they're just such exploratory conversations still. Nonetheless, it's the possibility that there might be some pilot that we would be charged in the health department with beginning to implement related to securing some different responses to mental health issues that might come in through 911. There's also an interest in making sure that our violence prevention work continues in as robust a manner as possible. And so on top of the increased expenditures that are already recommended in the mayor's budget, there might be more. So those are the things that might happen. And we'll know soon enough by early December. The third area is reimagining public safety. There were sort of quiet efforts across the city enterprise to follow up on the city council's statements that they made last July, and dissatisfaction that it was just too quiet and behind the scenes. And so the health department was asked to step forward and have a process that the community could kind of feel the transparency of and respond to. And so there is a survey that was put out into the community. It originally was going to close, I believe, last Friday, but we've decided that it'll stay open. So if you'd like to encourage people to complete that survey, that would be great. About 10,000 people have completed it so far. There's also, we're working with neighborhood and community relations. They're convening groups of folks to talk about basically the same questions as the survey. We're also got some consultants who are doing stakeholder interviews and also making the rounds talking to council members, because many of the council members have had community meetings. And so we want to tap all the input that has come in various ways from the community, and then have a plan to bring a report forward in early January, but then have continued input from the community to digest it and further digest it and discern. And so working towards a final report more in June. And within the reimagining public safety, there are 3 strands, if you will. One is certainly violence prevention work that's come to be under the health department. The second is the work that I was talking about out of the city coordinator's office, really looking at 911 calls and how do we respond in different ways? What do we have in our toolbox in addition to the police response? And then the third strand is looking at how do we, with the police force we have, how do we reform or change or modify practices? So those are the 3 main buckets or strands, whatever you want to call them, that we hope to pull together. And it really encompasses work that's going on across the enterprise, but we have been charged with basically pulling it together and knitting a full story out of it. So I'll stop there. Just a little bit of something. And I didn't even mention the resolution on racism as a public health issue. We're trying to land on who some of the process owners are for each of the recommendations in the survey or in the resolution, and we'll have a meeting of those folks in early January.
Gretchen, when will budget discussions actually happen at and kind of be finalized at the city council level? Because we don't actually meet in December. So I know that that work will happen in December, and assume that there will be some information we could at least share with the committee after those decisions have been made.
Yeah, they had their first hearing already in November. I'm glancing at I want to say something like the 8th or the 6th or, I would have to just like meander through my calendar. I'm sorry. We can make sure that you have that for the minutes, maybe.
Sure, that sounds fine.
Yeah, unless someone wants to do some kind of a search on the city clerk's site. I'm sure it's there as well. Sorry about that.
No worries. Are there any questions for Gretchen about anything that she reported on? I did get a message from the professor, from Deborah Erdley, related to your question, Jerome, about disaggregated data. And she writes back and she says, please let the committee know that the students admitted to not being able to gather disaggregated data because the website was down when they were gathering their data. They had to get a lot done by their due dates and then unfortunately lost sight of completing the disaggregated data to show the disparities among populations. So I just wanted to be able to share that with you, that she went right back and got an answer for you.
I saw a hand raised, I believe.
I did too, but I think it went back down. So, but I just heard a voice pipe in.
Yes, it's Mary. I just put my hand up. This is a question for Gretchen. Gretchen, that is a ton of extra work. I mean, it just makes me feel faint to think of all the extra things that are being assigned. And will you get adequate, will the health department get adequate resources to handle this huge extra responsibility?
To some degree, yes. I think because we probably have the personality historically of, okay, we'll figure that out, or we'll try and write some grants for that. Just the sheer volume of this additional set of asks in this time when, frankly, we have a whole bunch of staff that are still working on COVID. And has caused us to be a little bit more self-protective in terms of, we're going to need a person for that. We're going to need a person for that. So we won't be swimming in resources. But yes, I think we are going to have some additional support financially for staff to do some of these new things. Because the council also realizes that we want to do things well, especially rethinking public safety, addressing the needs of persons who are homeless. And we've had a couple years of really responding to that as if it's like something new. And I think they're realizing that it might continue. And so, yeah, thanks for that question. I think we'll be somewhat okay. We've got hiring freezes and stuff like that too, but we'll just see how the process churns. So.
Thank you.
Okay, Aaron, you're up next.
Yeah, Gretchen, you certainly have your hands full. I guess my question is, the reimagining public safety. How much of a priority is that for the council right now? I mean, is that something that you see having some sort of action on in the next year or 2 years, or if you had to just read your crystal ball, where do you think that's going?
Yeah, it's definitely top of mind for the council. I think forces have come together. This is a time to do something, and they've made public statements. Now the job is to figure out what do we make of those statements, and what did they actually mean. We certainly know that there's legislation to say that we need a police force for at least responding to a couple types of crimes, and so the words that were used, defund the police, I think sounded kind of finite, but it's more like, how can we do some of the things that we have tossed to the police to take care of? How can we do them in other ways? And then how can we also invest in prevention so we don't have quite as many of those things happening in our community? So they will use the budget process this year for 2021 to begin to shift and change, not a complete job, but they'll be moving in that direction. And then certainly, I'm sure by the end of 2021, adopting the 22 budget, will be making further changes. I think the notion of piloting is also really important, because even as we have a fair amount of agreement in the community that, yeah, it doesn't really make sense for the police to be the main responders for mental health. Once you've agreed to that, you still have to figure out, and so who is going to do that, and what are the mechanisms, and how are they going to figure out in 911 where to send somebody? So just the nitty gritty, and those are worthy things to have piloted, so you can figure out, oh yeah, that was a good idea that worked, or that was a good idea, it didn't quite work that way. And so I think we'll begin to see in 2021 these pilots, or a number of these pilots, and then continue to tune them and work on them. So yeah, it's very, very serious, intentional work. I can't tell you how many meetings per week I have on that topic with city council members and others in the city. So it's definitely one of their top priorities, if not the top priority. I found the budget markup calendar. So there is a public hearing on December 2nd in the evening at 6:05. That's called the Truth in Taxation public hearing. Then on the next day, December 3rd, in the afternoon, they begin to what's called budget markup, which is they take the mayor's proposed budget and they say, yeah, I got some amendments I'd like to make, or, they agreed on some of the things he's recommended. December 4th, they can continue to do the budget markup if they don't finish it on the 3rd. And then again during the day. And then December 9th at 6 p.m., there's another public hearing, and they take final action on the budget. So.
Okay, thank you so much.
Mm-hmm.
Thank you. Okay, and it looks like we have a question here from Andrew. Your hand is up, so.
Hello there. I was curious on this topic of reimagining public safety, either in terms of policy or with pilot design. To what extent is the department looking at maybe other cities' attempts, successes, either within the United States or in other countries?
Yeah, great question. Thank you. We are looking a lot at recommendations from national consultants that we have worked with all along, and new ones. We are looking at what's going on in other cities. In fact, one of the contractors we have started a relationship with to help us in this reimagining assignment is finding those best practices and how they're working in other cities. So there's quite a bit of awareness, both through our national consultants that we have relationships with, and then the work that we have asked our local consultant to do to make sure that we have the best information there. We've started to bring in some of the national consultants we've worked with on like our Cure Violence work that we just started this year, the Minneapolis outreach workers, consultants we've worked with on our that's not Cure Violence, our GVI, Group Violence Intervention, to begin to kind of reacquaint the citizens and our elected leaders with things that are already underway. It isn't as if we're just starting to reimagine. We've actually been reimagining for quite a number of years, doing new things. And so that's important for us to know we're building on a direction that was already set, even as we had new profound things happen in Minneapolis that caused us to, make solid statements of wanting change. We were already moving somewhat in those directions. And so we're going to try and build on those and build on the relationships that we had as part of that and build new relationships.
Thank you.
Mm-hmm.
Great. And then Angela, you've got your hand up.
Gretchen, as you go into this reimagining work and knowing that there's going to be a very public trial coming up in the spring, are there any plans to prepare community, prepare the city for what's going to be a long process right downtown?
Yeah, there's a lot of awareness that there are potential trigger points coming up in terms of people's sense of outrage, need for change, need to express long-standing, racism. And so, yeah, there's a lot of planning around potential times when those triggers might happen to make sure that people are able to express themselves and their ideas, but also do it safely for our community. So,
do you see that as being an intersection for some of the engagement work? It's kind of what I was kind of lay the foundation for. Is it going to be top of mind and people are going to be, present and just really full of emotion, ideas, and engagement? Is there an opportunity to intersect that with the work that you're doing to move things forward around reimagining, harnessing some of that proactively?
Yeah, I think that's an interesting question. I will certainly bring that to Sasha to think about. I know that many of our outreach teams have been engaged helping members of the community direct their anguish in ways that are not harmful to each other.
Right.
But yeah, I think what I'm hearing in your question is how do we capitalize on the ideas that flow forward out of those times and even before those times. So I'll think with her if there are some specific nameable things that we'll do with that. Thank you.
Thanks.
Great, thank you. Okay, and with that, I think we've got 7 minutes left before the meeting time ends. So thank you for answering all those questions. I think the next item on the agenda is the dates for the next year meeting dates. So on this case, do we vote on these, or what's the protocol? We do. Okay.
Yep. So just again, as sort of a precursor, our meeting schedule doesn't really ever change. It is the fourth Tuesday of each month. Obviously, during this time of COVID, we're still online with all of our meetings, and that will be for the foreseeable future. There isn't any indication that anything is going to change, back to in-person meetings for quite some time. So the committee can vote to approve the 2021 meeting dates, and then that will allow Hattie to go ahead and get our meeting scheduled with the city clerk's office, because these online meetings do have to be scheduled through the city clerk. They generate this meeting link, which is unique to each meeting. So you can't go back and use, a different link. But once the committee has approved the dates, then Hattie can move forward.
Well, since I don't see any discussion, I would like to move that we adopt the proposed schedule.
Okay, and can I second that?
You can call on someone to second it.
I will call on anyone who would on the committee would like to second that.
Craig Hedberg seconds.
I'll second it.
Thank you, Craig. So did KJ. We have lots of seconds. Perfect.
Okay, jump in there, Craig.
Now we do the roll call.
Yep.
Okay, let's go. Terry Ann Jones,
Yes.
KJ Starr,
Yes.
Mary Pike,
Yes.
Johanna Berry,
She may be dropped off.
Paul Pentel,
Yes.
Jerome Evans,
Yes.
Kathy.
Yes.
Britt's gone, right? Britt left early. Britt, you're gone.
Yeah.
Wanda, Angela Watts,
Yes.
Craig,
Yes.
Aaron.
Yes.
We have 9 approvals, so that passes.
Okay, thank you. Okay, the last item on the agenda is the subcommittee for reviewing the member-at-large applications, of which I understand we have a few.
Yes, we do. So again, just looking for 2 or 3, maybe 4 folks who would be willing to form a subcommittee. What happens at that time is the applications to be considered for at-large are shared with the members of that subcommittee. We read through them all. We determine, we've already developed interview questions, but we kind of review those, make sure that those make sense, and then, use some metrics to determine who's going to be interviewed and then actually conduct those interviews. So the committee itself will be the body that brings forward the names to fill the at-large seat. And so then once it goes to council, council basically approves that candidate because it's somebody that the committee itself has nominated. So I already heard from Anna Arkin that she was interested in being a part of the committee to review. And I think, Jerome, I think you and I had talked about you possibly being on that, or was that?
I am very interested in getting these seats filled, so let's do it.
Yeah, and so then if there were a couple of other people who, and we can float this out via email again to other committee members, but yeah, usually a small group works really well. We can sort of keep the process moving, and yet there's enough people to be able to have, divergent thoughts about how, we narrow down the possibilities and decide who is going to get an interview. Anybody else on the call want to step forward? Seeing none.
Sure,
then
I'll jump in there.
Aaron,
This is Aaron.
Okay.
Yeah, I'll
great.
volunteer for that.
Oh, perfect. Thanks, Aaron.
Thanks, Aaron.
Awesome. So I'll maybe float out one more email that just says, you know, we've got 3. Is there anybody else, you know, who has a burning desire to be a part of that process? And then we'll probably do some of that work in December because it does take a little bit. So we may have a subcommittee meeting, or I may, you know, float out the applications to you, you know, to just get that work started so that there isn't such a time delay until our January meeting.
Sounds good.
Perfect.
Great.
Let's do it, Kathy.
All right. Are there any other items to discuss in the minute we have left? Then I'm out of here.
And a reminder that there's no December meeting.
Yes, there is no December meeting. So the next one is January, months away. Who knows what will have happened by then? I think it's like the 21st or something like that. It's
26th. 26th. Mm-hmm.
Well, I would like to congratulate you, Kathy, on successfully chairing your final meeting.
Yeah,
very well done. You've been a great partner.
Someday I'll get the whole Robert's rules.
What'd you say?
Someday I'll get that Robert's rules thing. It's Robert's rules, right? Or it's the, you know, motion and all that stuff. I don't know. It's supposed to be good for meetings. I still don't get it, but.
You did great. Thank you for doing this job.
Thank you, KJ.
Serving on the committee.
What's that?
I just insert, it's a service to the committee to have people chairing it.
Yes,
Someone's
and
got to
there-
do it. Thank
There
you.
will be another opening, I think, too, right? Once yeah, so, okay. All right, everyone. Well, I declare that this meeting is adjourned then.
Excellent.
Okay.
And thank you again to Andrew and to Christopher for joining us. And just stay tuned for more information about the PHAC and the process that the 2 of you are on.
Great. Thanks for having us.
Yeah.
Nice
Have
to
a
meet
good
you.
holiday, everybody.
Happy Thanksgiving, everybody.
Happy